We're not going to rest on the laurels or the accomplishments that GMH has done as far as the Joint Commission accreditation. We want to build on that. The facts are is that given the number of people that expected to come to Guam in the next decade, we're expected to increase our population by 25%. So, there are estimates of about 40,000 people, all the way up to 80,000 people moving onto our island in about a decade. Well, obviously, we don't have enough healthcare beds, we don't have enough hospital beds now for our needs today, let alone the needs that are anticipated for this buildup. And so we're going to need an additional 100 beds at a minimum. Now, we continue to support the private hospital venture that Peter Skrow and Group have been actively trying to get investors for, and we're hoping that they're going to be successful because this obviously helps all of us as a community. But in the meantime, I think that there needs to be another parallel front to ensure that the beds are going to be here today and also tomorrow when we need them. And so one of my thoughts, and one of the things that Jim and I have discussed is we need money, obviously, to be able to build additional beds. And we need to start thinking about a Guam Memorial Hospital Regional Medical Center of the Marianas up at Hospital Point, which is what that place was designated for in the first place, to start building a new state-of-the-art medical center that's going to be able to take us to the future. And one of the ways of doing that is to initially start with what I think is to build a 50 bed women and children's hospital. I think that most people would not disagree that women and children are extremely important, and we deliver over 300 babies at GMH on a monthly basis. And so as we build a 50-bed women's and children's hospital as part of phase one of this new larger regional medical center, it immediately frees up 50 beds at the current institution. And with less money, we can refurbish those beds for the particular bed types that are necessary today, which is the monitored beds, emergency care, and ICU and CCU. The 50-bed Women's and Children's Hospital would come from funding that we're seeking with the USDA. And part of getting that is to designate this 50-bed hospital as what's something called a critical access hospital. With critical access hospital designation by the Department of Health and Human Services, USDA will be able to give us a 15% matching loan, which is 85% U.S. federal government and 15% local funds to be able to build this new state-of-the-art 50-bed hospital. In addition, now that GMH has Joint Commission accreditation, it can start engaging with discussions with other federal government agencies that it otherwise was not able to do. As an example, we're now able to take care of TRICARE patients, which is the military version of CHAMPUS, which you used to have before. One other discussion that I've already had was in working with the Veterans Administration. We know that there is a significant amount of veterans that are here in Guam, and they're going to continue to grow given the current wars that we're fighting. It would be great to be able to work with the Veterans Administration because active duty hospitals typically want to take care of active duty members and their dependents, not necessarily retirees and not necessarily veterans. And so by working with Veterans Administration, can we work together to build a veteran service within the new regional medical center, since we're also Joint Commission accredited? Another thing, in speaking with the Department of Defense, and I spoke to the Deputy Secretary of Defense who was here, Mr. Lin, Secretary Lin, just last week, is, what if the Department of Defense wants to just take care of its active duty members, then go ahead and do that with just your basic hospital. But you know what, why don't we work together and let GMH and the Department of Defense build what we call centers of excellence. GMH has been doing open heart surgeries now for the last 2 years. Navy Hospital, you don't need to have an open heart program there or heart surgeons, because we do that and we can continue to do that. And working together, we can build a center of excellence for cardiovascular disease. We can do the same for neurovascular disease because we have neurosurgeons at GMH, which they don't have at Navy Hospital, and other neuro rehabilitation medicine and others like that. Then lastly, working with UOG and GCC, I think we can turn this new regional medical center, Guam Memorial Hospital Regional Medical Center, as a teaching hospital, so we can ensure that the staffing and the health professionals that we need, both physicians, nurses, and the ancillary health care fields, would be able to be trained so that we can staff the needs of our community here and certainly the region around it.
Well, what do you add to something like that? Except, again, from perhaps my perspective, more of non-medical perspective, this is an exciting opportunity. When we start talking about growing our economy and growing new opportunities, if we start down this road in terms of healthcare, this opens up a whole new economic base for our island in terms of training at University of Guam and GCC, and maybe even starting as young as high school, maybe even middle school. So people already can start charting their career paths. When you start talking about physical therapists, you start talking about nurses, you start talking about doctors and whatnot. Again, this is an exciting opportunity for our people to latch onto a whole different kind of economy that we foresee coming.
One of the anticipated questions, and if I could just go ahead and do that now, is that people are going to be concerned about how we're going to be able to staff this new hospital, this new medical center, as we already have a shortage of nurses and doctors now. And you know, that's an excellent question, because it is estimated that there's going to be almost 800,000 to 1 million RN vacancies in the United States by the year 2020. Now, this is also going to include a significant shortage of physicians, as the medical leadership of the United States completely underestimated the needs of the baby boomers that are retiring today as we speak. And so how does Guam then compete with the rest of the nation for nurses and for doctors? Well, you know, interestingly enough, is that there's a country only 3 hours away from us that exports health professionals to the rest of the world. And they fly over us, go into the United States mainland and to other nations. And so these are some of the things that we're going to need to be able to work with our federal government to leverage the needs of our people. And the fact that here, only 3.5 hours away from us is a community or a very robust medical system that we should be able to ensure that our people are taken care of here. And so we're going to be looking outside the boxes that currently we practices here in Guam. And in speaking to the medical professionals, they're excited about some of the ways that we can work with the medical professionals in the Philippines and some of the other nations to ensure that the health care of our people can be taken care of here, right here on island.